So, huge fan of everything people were saying. I went on the path of started with Weston Price over 10 years ago of getting into this. So, for example, to lead into my question, I've eaten a high saturated fat and high fat diet for a while, and it's helped a lot to solve a certain health problem I have. And that's what I suggested to a lot of people. But then I started seeing that not everybody had that effect. And so I started reading around how genetics affects these things. And that's a very early study, and people make too many assumptions. So question is, in your practice with your patients, have you started to look at some of the research in how, we know that there's not one perfect diet, it varies per person. Have you started to look at how certain genetic factors such as APOE and those type of things can affect that? And are you using those, or are you looking at the future of research that's going into how we can have more personalized medicine, personalized nutrition and whatnot relating to genetics?
Okay, I'll quickly respond to this before the experts in the medical field discuss this. Just in relation to the question around, the perfect diet, the one size fits all. If anyone's read the book, The Blue Zones, has anyone read that book? Okay, great. Read that book. Again, this is what I've been strict paleo for almost 10 years now, and I'm a big advocate of paleo, and I pretty much stick to the original prescription from Cordain, and I'm very happy with that, and I'm very happy with the blood test results that I have up to this day. However, I read the Blue Zones, and there are basically 7 zones around the world that people live live to 100 years old, basically. So best examples of longevity on the planet. And when you see the Venn diagram as to what the diets are and the commonalities, what's really striking are you have some diets, high grain, high carbohydrate, some diets vegan, so Seventh-day Adventists in California have a vegan diet. And if you read that book, there are 7, basically all the diets are different, and all these people live to 100 years old, and not live to 100 years old and being decrepit, actually have very low levels of morbidity as well. So there's a lot to talk about what the common elements are across all those blue zones that really are impactful to health.
Yeah, I think Darryl's right. One size doesn't fit all. One of the reasons why I picked on sugar is actually something which we don't need. So I think there are certain things we have to realize we do not need as part of our diet and are harmful, and get rid of those. Then there's more of a grey area, whether it's low carb or higher unrefined carbs, and then try and find really what's good for you. But again, I think there's 2 different discussions. One is about your weight, but then also one's about your risk. So at the moment, we have to use the best available evidence we have from randomized controlled trials, and that's not to say there aren't things out there that will probably come about from future studies that show other foods that aren't part of the traditional Mediterranean diet are beneficial. But what we should do really also is use the best evidence we have on foods that impact your health overall. But again, yes, I think people from South Asia in particular are prone to insulin resistance. So I think South Asians, people from the Indian subcontinent, for example, that's an area where they should be reducing their refined carbohydrates considerably, because they're more vulnerable to weight gain and adverse health consequences from that. And just coming back to what Darryl said a bit earlier as well about, absolutely, we should not. Physical activity in some ways can be, called the miracle cure. The question is, how much activity should you be doing as well, and what's optimal for you? You can. I'm sure Darryl knows a lot more about this than I do, but even a 30-minute brisk walk a day can actually do tremendous benefits for your health. In the grand scheme of things, it's important to embrace different lifestyle factors. And, according to the Lancet Global Burden of Disease reports, most recently, when you look at diet, physical activity, alcohol, smoking, poor diet actually contributes to more disease than the combination of smoking, physical activity, and alcohol. So it's combining all of that. And in terms of reduction in cardiovascular death, smoking reduction in prevalence had probably one of the biggest impacts. But what we haven't really fully appreciated, and I think this is a very interesting area, and I think Darryl's already alluded to the bus conductors, is the impact of stress and how we can really measure that in studies to see how stress impacts on our health. And I think that's a huge factor. The problem is it's very difficult to measure objectively.